most opioid overdoses can take up to several hours for it to actually to go from phase to phase. So the person starts to breathe very slowly, their heart rate begins to slow down, and sometimes you even hear a sort of snorting respiration. So what's happening, of course, is the heart is beginning to slow down, the breathing is slowing down, and then eventually, over a period of time, the person actually stops breathing and dies.
The earlier signs are that the patient will go on the nod and be unresponsive to stimuli, whether it's voices or whether it's somebody rubbing their chest or what have you. That might be an early sign that this is somebody who's about to be in some serious trouble.
Pay attention to the signs of an overdose, the pinpoint pupils, the fact that the person's color has changed. So of course, as the blood is slowly going around the body, then the person begins to turn very pale. Their fingernails often go very blue. You can hear the very shallow breathing.
When somebody overdoses on opioid, there's a number of things somebody can do. I think the first thing is to call for help. So I think 911 would be the first place to call, and follow that, perhaps doing CPR, because these medications tend to shut down your respiratory system, so you have to give breaths. Even if you don't know how to do it, when you call 911, you can be coached on how to do it.
So very important to make sure that client, the person is still breathing. So we encourage everyone to do rescue breathing. It's not difficult, and certainly as we go forward with the rollout of the Naloxone program, there will be training on how to do rescue breathing. And then if you do have Naloxone, this is an opportunity to be able to administer the Naloxone. It generally takes 1 to 3 minutes that you'll find a response.
So generally speaking, with a run-of-the-mill opiate overdose, a dose of Naloxone or maybe a few doses of Naloxone will awaken the patient, maybe put them into some opiate withdrawal. They'll be upset, but they won't be dead. Their respiratory rate will come back. They may have some convulsions. They may have an acute opiate withdrawal syndrome with vomiting and sweating and runny nose and those sorts of things. But if we know that what we're treating is an opiate overdose, Naloxone will reverse it if it's administered in time.
Now, if that response hasn't happened within a few minutes, then it's important that you keep doing the rescue breathing. And if there's still no response, that you give another dose of Naloxone. And by the time that sort of sequence has happened, hopefully the emergency services are there.
When you're dealing with fentanyl overdoses, it's a little bit more tricky because the typical doses that you use aren't effective, or they can last a very short time. So people often have to get more of the medication and for longer periods and require more monitoring as well.
The challenge with the illicit fentanyl that we're seeing, as we talked about, is that with the contaminants of other drugs, like xylazine, which is what we call an alpha-2 agonist, naloxone's not going to have any effect on that. And really the important thing is if you've treated that person with naloxone, you still need them in hospital for supportive care.
And a lot of people think that sometimes if you overdose and just give a Narcan, everything is okay, and for the brief amount it might be. But what can happen is that that second phase can occur as well. That's why people need to be monitored for a little bit longer time.
In any event, if you see somebody who looks like opiate overdose, administer naloxone and then get them to hospital.
Barbara, rarely does OD cause bradycardia, slow heart rate. This happens because calcium levels become out of whack, lack of oxygen. Supply rescue breathing should increase heart rate and normalize blood chemistry. Never give a slow heart rate chest compressions. Worst thing you could possibly do. Krishna at 1 minute 25 seconds. Please stop confusing people with the term CPR for first aid, rescue breathing only for any breathing emergency. Rescue breathing is first line defense, naloxone is second line defense. Don't suffer any of the hundreds of causes of breathing emergency in Ontario, Canada. Tens of thousands taught to give chest compressions only, specific to to a respiratory emergency. Persons need rescue breathing ASAP.